Hi, this is Dr. Diana, and in this presentation, we will be discussing implementation and evaluation.
When we reach the implementation stage of the nursing process, we are putting the care plan into action. This means carrying out the nursing interventions or orders that were identified during the planning step. For LPNs, this often involves assisting with direct care, supervising unlicensed assistive personnel, and ensuring interventions are done safely and correctly under the direction of a registered nurse or provider. Implementation corresponds to the clinical judgment measure model step, take action. Implement care effectively. Priority setting is crucial. You cannot do everything at once, so you must decide what needs immediate attention. Start by reviewing the handoff report, which highlights high priority tasks such as vital signs, IV fluids, medication, or time sensitive procedures. Use a worksheet to organize your shift. List out both time fixed tasks, like giving pre op meds at 8 a.m., and time flexible tasks, like helping with hygiene, which can be adjusted around the schedule. Finally, be ready to adapt your priorities throughout the shift. If a patient's condition changes, you may need to pause less urgent tasks to address the new need. This is where your critical thinking and clinical judgment skills guide you. Considerations for care delivery. When carrying out interventions, the first step is to think critically about why you're doing it. Ask yourself, what is the purpose? What outcome do I expect? What are the risks if I don't do it properly? For example, during invasive procedure, there's always a risk of infection, so sterility must be a priority. Types of interventions. We categorize interventions into three types: independent nursing actions, dependent nursing actions, and interdependent nursing actions. Independent nursing actions are those you can carry out without a provider's order. These rely on your knowledge, experience, and clinical judgment. Examples include patient teaching or providing comfort measures, like back massage. Dependent nursing actions require a primary care provider's order. These include giving medications or applying heat packs. They are dependent because they require provider authorization, though you, as the nurse, must still use judgment to carry them out safely. Interdependent nursing actions involve collaboration with other members of the healthcare team. For example, assisting a speech therapist with patient exercises is an interdependent action. Let's talk about interprofessional care. In many hospitals and long term care settings, care is guided by an interprofessional care plan. You may also hear this called a clinical pathway or care map. This type of plan is collaborative and step by step, involving input from multiple disciplines like nursing, physical therapy, dietary, and social work. The RN case manager usually monitors progress to ensure expected outcomes are met on time. For you, as an LPN, your role is to follow the nursing process with that framework and communicate changes promptly. This is implementing care, which is about actually carrying out nursing interventions. The first rule is always check your facility's policy and procedure manual. Even if you learned a procedure one way in school, your workplace may have slight differences. Legally, you are accountable for performing care according to your agency's standards and your state's Nurse Practice Act. In Ohio, you would refer to the Ohio Revised Code and the Ohio Administrative Code. For efficiency, we talk about clustering care. For example, while you're in the room to give a bed bath, you can also assess skin integrity, range of motion, and gather more data. This saves time and avoids unnecessary disruptions for the patient. Cultural practices are also critical. Some patients may prefer caregivers of the same sex, or they may want family members to assist with bathing. Always ask and respect those preferences. There are standard steps for all procedures, and they can be broken down into three stages: preparation, performing, and concluding. In preparation, review the steps, verify the order, gather supplies, identify the patient, explain the procedure, and provide privacy. In the performing phase, use standard precautions and aseptic technique when needed to perform nursing interventions. In concluding, clean up, make the patient comfortable, restore the unit, and document what was done, including the patient's response. The big takeaway: implementation is not just doing tasks, it's about safe, culturally sensitive, legally sound care while working as part of the interprofessional team. Now we move to the final step of the nursing process: evaluation. This step is guided by the National Association for Practical Nurse Education and Service, Standard C. Once interventions have been carried out, you must determine if they were effective in helping the patient reach their expected outcomes. Evaluation means comparing actual outcomes to the expected outcomes. For example, with Mrs. Torres, if she stays dry for 2 hours at a time, she's meeting her short term goal. If she has an accident, you must ask why. Was it too much fluid at dinner or a delay in assistance? This shows us that evaluation isn't just checking a box. It's about asking what worked, what didn't, and what needs to change. Evaluation is continuous. Patients give feedback, families provide input, and the nurse reassesses if interventions are the best choice. In long term care, residents and families are directly involved in reviewing outcomes and revising care plans. In home health, the patient, family, and home health aide contribute to deciding whether the plan is meeting their needs. If an intervention was ineffective, revise it. If a problem has been resolved, mark it resolved and remove it from the care plan. Hospital care plans are often updated every 24 hours, with problems inactivated, new ones added, and interventions revised. Now, let's discuss how nursing care plans are revised and how evaluation ties into quality improvement. When interventions do not work as planned, they must be revised if the interventions are effective and the problem is resolved. The problem statement is marked as resolved. Nursing care plans in the hospital are updated at least every 24 hours. Problems are inactivated and new ones are added, and interventions are revised. This is often done electronically, with the LPN working closely with the RN to keep the plan current. Evaluation. It is not a one time step, it is constant. Each nurse asks, is there a better way to help the patient reach their outcomes? This continuous cycle of evaluation and revision is at the center of safe and effective nursing care. Now, let's connect this to quality improvement. The evaluation process not only looks at individual patients but also at overall nursing practice. Hospitals use outcome based quality improvement programs to raise the standard of care. One method is a nursing audit, where patient records are reviewed to see if standards are being met. For example, checking if IV cannulas were changed within the required time frame, or if each problem statement was documented daily. These audits and evaluations are not about blame. They are about improving nursing practice, ensuring safety, and promoting efficiency. Nurses often rotate quality management roles within their units so that everyone is involved in the process. Remember, evaluation and revision ensure that nursing care is patient centered, safe, and continuously improving. Now, let's discuss who constructs a nursing care plan. The registered nurse usually initiates the plan. The LPN may help create a preliminary plan, but it must be reviewed and validated by the registered nurse. Students often prepare a care plan or concept map for their clinical assignments to help them practice forming nursing care plans. Let's take a moment to review the steps in constructing a care plan. In most settings, the RN initiates the plan of care. However, if an RN is not available in a long term care facility, the LPN may prepare a preliminary plan, which must be reviewed and validated by the RN. As students, you may be expected to bring a nursing care plan or concept map to your clinical experiences. This prepares you to think critically about the patients that are assigned to you. The process follows the nursing process in the clinical judgment measurement model. You begin by collecting data. This means taking a history, doing a physical assessment, reviewing labs, and checking the health record. Next, you analyze that database to determine what problems exist or might develop. After identifying and grouping the problems, you write appropriate problem statements or nursing diagnoses. Then, you must prioritize. Remember, physiological needs like oxygenation and circulation come first.
Involve the patient when deciding what matters most to them. Next, you create a plan by defining goals and writing expected outcomes. Outcomes should be specific, measurable, realistic, and time limited. For each problem, you then choose nursing interventions that will help the patient achieve those outcomes. Once the plan is written, it must be documented and communicated so that all staff members can follow it. Then comes the implementation phase, where the interventions are carried out. Finally, you must evaluate outcomes. Did the interventions work? If not, revise the plan. This cycle of assessment, planning, implementation, and evaluation ensures that care is organized, individualized, and effective. A nursing care plan is not just paperwork, it's a roadmap for patient safety and quality care.